these conditions dominate, and the reason is, as I said earlier, they all have their origin in the same fundamental problem.
Yes.
The jaw can't function correctly if it's mal-oriented to the lower jaw is mal-related to the upper jaw.
Yeah, the upper jaws maybe didn't develop forward enough.
Didn't develop forward enough to allow the lower jaw to develop forward enough. The upper jaw didn't develop forward enough, so the pharyngeal area, the area where you breathe through here and where you swallow through, that did not develop in the proper dimensions.
And is that mostly because the tongue's not up there on the palate to push the upper arch forward? Is that why we see this so much? The tongues are down?
Well, it's a kind of an academic argument about, well, is it the chicken or the egg? What came first? And I think we have to go back and look historically at what humans are actually designed to do.
Yeah.
After several million years of evolution, there became human beings, and we were designed a certain way.
Yeah.
We're the only mammal that walks on 2 feet and upright. No other mammal does that. That means that our airway had to undergo significant modification to turn a corner rather than be straight like all other mammals are. Cows and monkeys, even, yes, monkeys sit upright and stand upright and walk a little bit, but their upright posture is not their full-time posture. They're always leaning over like this.
Yeah.
If you notice in videos, nature videos of monkeys or gorillas or whatever, they have a leaned over posture. It's because they have a straight spine, straight neck, and the face is more forward than ours. Our face is down this way. Their face is more forward of the cranium. So those are developmental features that we can see historically in anthropology and observing those things in biology. So when we were Aboriginals, true Aboriginals, living hunter-gatherer wise, we didn't live in structures. We had some of them had some movable structures, but we didn't live in structures full time. Most Aboriginals observed today do not sleep indoors often, only when in very inclement weather. They sleep outdoors in the air, and they sleep on their back. And most people north of the 30th parallel can't do that. They sleep on their back. They're snoring and gasping. It's just not a good sleep position for them. But those people developed without any conditions that caused this to change its growth pattern. So what would be the most dramatic change that you would have? Well, the most dramatic change you would have would be congestion of the upper airway. So if you begin to develop allergies, or you're living indoors more in an enclosed space more, even though it may be a grass shack 10,000 years ago, or a thatch shack or whatever, you had a lot of toxins in that area.
Versus being outside.
Versus being outside. You had animals dwelling in the building materials itself. You had molds, you had animal feces, you had animal fur, you had insect feces and insect parts, which also causes allergic reactions. So we can surmise that was a big problem initially, and then so the upper airway could not develop because the matrix, or the component that makes the upper airway develop correctly, including the upper jaw, we call this the nasal-respiratory complex, is air moving in and out of your nose. That's all it is. It's not an orthodontic wire, it's not a force, it's not a screw, it's none of those things. It's a gentle force, just like that you can barely feel. Repeatedly in and out of the nose. That's what the stimulation is for these areas to grow.
For the upper to grow
forward.
Upper
to grow forward and wide and forward. So most, we looked at 1,000 of our patients' databases, looked at their cranial formation patterns. Didn't matter what race they were, sex, didn't matter. We just took 1,000 random patients and looked to see if they had a shortage in the maxilla or not. And about 90% of them were short. We're short from where we know Aboriginals are, because we have those skulls as well. There's probably 25 or 30 at least Aboriginal groups still out in the wider world that don't live like we do.
Yes.
The other factor was the change in food, which occurred worldwide, oddly, all over the entire world, and this was before the internet, all over the entire world. Within about a 2,000 year period, people began to farm. And when they started farming, they needed to maintain and hold that property. So that meant they were no longer moving. We have evidence of, in the Middle East, of Aboriginal tribes living in the same close area to each other, but one is a farming community, other is Aboriginal community. So we know they coexisted for a long time, and we still do. We don't see those people. We go to Eastern Washington, those people aren't in Eastern Washington. There's nobody like that around here anymore.
Yeah.
We've all changed to this Western mode of living indoors, and then eating a very processed food. This is also a big thing. Currently, there's probably very little that you could find in a grocery store in a modern Western setting, or even in China or Japan or any of those areas. Anything north of the 30th parallel has become more developed. So we go to the grocery store and we look around in there, and we all kinds of good foods there. Much of it's not very nutritious, and hardly any of it requires chewing.
Right.
Most of it you could gum it really easily and get it down, you know.
And that
Even a hamburger, you know, you could tear off a piece of it, stick it in your mouth. You don't have to bite it.
That's true.
You tear it off, put it in your mouth, wish around in there, and then people do that.
Yeah.
There are people without any teeth. They only wear their teeth to church.
Yeah.
You know, the rest of the time they're living in a community where they're doing a job where it doesn't matter if they have teeth or not. You
Yeah.
know? So I've had patients like that in my early career where they'd say, don't worry about this or that, doc, it's fine. I only wear my teeth to church on Sunday.
Well.
But most of us want to have teeth all the time. So the actual chewing of hard food, hard, tough foods, is also what stimulates the growth not only of the maxillary complex, but also the mandibular. In other words, the whole craniofacial complex is stimulated by that.
Yeah. So to review, the air coming through the nose, and then the foods that are harder, like apples and tougher meat, and
Correct.
that helps develop.
And then if you're not able to breathe through the nose properly, you're going to breathe through your mouth. If you breathe through your mouth, your tongue cannot be up in the roof of your mouth,
True.
because that blocks your mouth airway.
Correct. Yeah.
But that's where the tongue's supposed to be. It's supposed to function up there during swallow and be up in the roof of the mouth during rest also. But that only occurs in my patient population. I see it maybe 10% of the time that it's actually in the right place.
Yes.
Having said, they still have some other conditions, but not everything is wrong, right?
Right.
So that can be changed with myofunctional therapy and so forth, these other treatments, but they have to be done together. And you've seen many of those kinds of patients where, well, we have to do something with myofunctional therapy here. We have to get the tongue up there. You can't just tell the patients to put their tongue up there. It's not going to happen. You can't tell them, well, don't breathe through your mouth anymore. You can't just tape their lips. If they don't have nasal patency,
Right.
you can tape they're not going to put any tape on their lips because they literally can't breathe then. And so that doesn't work. So the strategies have to be properly organized. So chewing the food, and then we have the problem of breastfeeding. So in our more recent modern times, babies are not breastfed for 3 to 4 years, which is the normal human breastfeeding pattern.
Yeah.
Now, you're not just only breastfed to 3.5
Right.
years old, but these communities that still live like early primitive humans, they don't have, the women don't have babies every 2 years.
Right.
I mean, I have patients and family that, I mean, they have a new baby every year and a half. They got a new baby, you know.
Yeah.
They have a baby and they get pregnant really pretty soon after the first baby.
And then you can't nurse.
And you can't nurse,
Yeah.
and there's no time. So it's also a stress on our females in our population, having
Yes.
babies that in an increased frequency. Just it's just not. It's hard on the gals for sure.
It is, yeah.
It's hard on them. So a lot of things have changed, and the breastfeeding is part of that component as well. Not much of the dentist can help with that, although we do. It is more properly known now.
Yeah.
I mean, I was doing tongue-tied release 40 years ago in some patients because they needed it. Now it's a very common thing, and unfortunately what I'm seeing in the practice now in second opinions are people coming in who've been recommended a tongue-tie release when they don't have a tongue-tie.
Yeah.
They're
So
not tongue-tied.
a second opinion.
And they've had, if they are marginally tongue-tied, they've had no myofunctional therapy prior to, because often that can correct a marginal case, just the
Yeah.
myofunctional therapy itself. So you don't need to do surgery. But
I was one of those people that,
Yeah.
that you scanned me and said my airway was really open, but I do have to strengthen my tongue to have it be, because my palate's high,
Correct,
to have it be up there.
correct. And just widening the palate, like
Mm-hmm.
I hear a lot these days about expansion. Patients are told, well, we need to expand your upper jaw or expand your dental arch or whatever. They're usually often not very specific about what exactly is they are expanding.
Yes.
Are you expanding the bones of relationships? Are you expanding the teeth within the bone? There are significant limitations to all that, and so it's important to understand what kind of expansion are we talking about and how is that going to be achieved.
Yes.
It's not a one trick pony. Expansion is not all expansion.
Well, and that's
And what are you trying to affect, and what is
Yeah.
the end result going to be? So